starting out 2023, I feel like the amount of suboptimal thyroid sufferers has skyrocketed. And we've talked about this. And even in my own family, I've seen situations where my husband, totally good fat burner, he eats great, but has great profiles, great blood tests, and all of a sudden things are falling apart. And it's nothing he's doing. It's the environmental toxins, it's age, it's all of these other things. But you are seeing a lot of people with unexplained symptoms, weight gain, hair loss, all of that. So I wanted to start out with the difference between hypothyroidism and hyperthyroidism. Let's start with hypothyroidism. What is hypothyroidism, and what are the symptoms of hypothyroidism that people should look out for?
Absolutely. So we have two different types of hypo. And when we're looking at hypo, low and slow, we're looking at that whole umbrella of a slowed down thyroid. We have to look at the autoimmune component. So 95% of all hypothyroidism is Hashimoto's. It's the autoimmune form of hypothyroidism where your own body is attacking your thyroid gland, causing it not to produce the T4 and T3 hormones adequately. And as that thyroid gland gets destroyed essentially from the antibodies attacking it, it's producing less and less and less thyroid hormone. When we look at the symptoms associated with it, it's all low and slow. So it's weight gain, low metabolism, slow metabolism, slowed down digestion. That's where they'll get the constipation. They'll get really fatigued. They might get a lot of bloating and GI distress. We'll see hair loss. We'll see depression and or anxiety, insomnia, joint pain, inflammation. There's so many different symptoms associated with hypothyroidism. Hyperthyroidism is more rare. So when we're looking at hypo, we know 95% is Hashimoto's, and it mainly hits women, unfortunately. Now, we do have that group of men that also have hypothyroidism. We're not leaving them out, but when we look at the stats, it definitely affects women more simply because we have lower testosterone levels. Testosterone is very protective against autoimmune, and we just naturally have low testosterone levels. Some women have too low, but just as our female race goes, we have lower testosterone levels than men. Men have higher testosterone levels, and that protects them more from Hashimoto's appearing and presenting itself. But men still get it. Then when we look at hyper, that is much more rare across both sexes. Mainly when we're seeing hyperthyroidism, it is the autoimmune form, Graves' disease. It is when, again, the immune system starts attacking the thyroid overproduces T4 and T3. And this is where someone will be, I call it icky and sticky. It's like they're jittery and anxious and losing weight and everything is amped up, which many of you out there might be saying, like, please, me, I would like a faster metabolism, but it's not good. You don't want to be in that hyper amped up state because then it starts taking a toll on your heart rate increases, blood pressure increases, body temp increases. Eyes can start to bulge out. So that's the classic hyperthyroidism, the thyroid eye disease, where you see people's eyes kind of bulging out of their head. And that does not go back with medication. That requires surgery. So we don't want to push you into hyper, but it's very, very rare. And what I see in a large majority of when I do see Graves patients, either they have Graves antibodies and Hashimoto antibodies at the same time. They do this pendulum swing back and forth. That can be just their own body overproducing and then underproducing thyroid hormone, or it could be from the treatment that they're receiving from their doctor to slow down their thyroid, which then pushes them into a low and slow hypo state. Or I will see them after they've already had their thyroid gland removed because of Graves' disease or had radioactive iodine because of Graves' disease. Essentially, the medical system wanting to kill their thyroid gland so it's not overproducing and causing heart palpitations and heart issues and anxiety and insomnia, but normally that pushes them too low and then they go hypo and then we have to build them back up from there.
And this is so interesting because I was just researching mental health and thyroid, and a lot of people are put on anti-anxiety or antidepressants because of their symptoms, and they're not going to get any better because that's not the root of the problem. The root of the problem is the thyroid. And so, of course, when you are not feeling well or you're fatigued or you're sluggish, well, psychologically, God, I'm never going to get out of this rut. I just don't feel good. That then becomes depression, right? It's like this vicious cycle. And then the body, mind, spirit connection, then you associate yourself with being overweight, having a slow metabolism, having depression. I'm that person on antidepressants.
Yep.
Then that is a self-fulfilling prophecy.